see. Okay, we're live. Good morning, everyone. Good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Olabintan. I'm the CEO and co-founder of Livingspring Family Medical Center here in the beautiful city of Mansfield, Texas, not too far from Dallas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. And today we'll be having a topic that's it's related to something rather common. The topic is doc. I'm told I need to get a back injection. I'm nervous. Help me. And I'm happy to be having this live with a fellow Mansfield native or liver in person, our fellow Dallas, Texas area provider or physician, Dr. Thomas Hung. Doc, good morning. How are you? And thank you for coming.
Good morning. Good morning. Thanks for having me.
Oh, my pleasure. For those who are watching, Dr. Hong is he's board certified and fellowship trained physician in the field of pain management and anesthesiology. And I do get to refer quite a bit of my patients to him for said procedures and other things related to pain. So, Doc, for the sake of those who are watching us, could you kindly introduce yourself? Who are you, and what do you do?
Yes. So as you mentioned before, I am formally trained in anesthesiology. That's my primary specialty. And then I've done subspecialty training in pain management. So what I do is for patients who are struggling from, more difficult to control pain, pain that doesn't go away within, 4 to 6 weeks. And, now it's more chronic pain, not just acute pain. Now I help try to establish a diagnosis, find out why the patient is having pain, and once we've discovered that, we try to treat it with either medications, physical therapy, injections, and whatever that may involve in worst case scenarios, maybe even sometimes surgery. So we really try to help figure out what's going on, and then help provide the appropriate treatment for whatever the diagnosis is.
Awesome. I like what you do. I've had patients testify to how helpful it's been long term and for them to be able to get back to doing the things that are important to them. So thank you for what you do. Now, my next question to you is this: Why do you do what you do? Is there a story behind why you chose this path?
Well, when I first got into anesthesiology, I really wasn't even thinking about getting into pain management. I was thinking more, some of the other specialties like ICU and such.
Okay.
But I have an uncle who does some pain management, and he kind of allowed me to shadow him for a few days and saw what he was doing, and just the ability to continue to have continuity of care in the field of anesthesiology. There's very little continuity. You either see patients in the operating room, you see them in the hospital for a moment, and then they're gone. But I can actually develop relationships with patients, and there is something really gratifying about helping treat or cure someone who's had significant chronic pain. That's some it's quite gratifying. So, and the procedures that I do, they're numerous, and the field is continuously evolving. So I'm always learning something new, and getting a new tool to help my patients with.
Awesome. Thank you for what you do. I like what you do. I like what you do. So now, for someone who's preparing for a back injection, sometimes patients come to see us. Oh, my back hurts. We tried this, so the pills. This doesn't work. We tend to say let's send them maybe to a pain specialist like yourself for a back injection. What when do you typically see that someone, or when would you say someone needs a back injection?
I would say if there is significant pain that is more than six weeks to 3 months, that's when you should start to kind of try to find out what's going on. Because initially, if you have little aches and pains that have been going on for about 4 weeks, 6 weeks, a lot of that the body kind of figures it out on its own, right? You've got a lot of soldiers and doctors inside your own body that kind of takes care of little cuts and bruises. You throw it on there, you throw some medication on there over the counter, and it kind of goes away, right? But if it's still there after 6 weeks, 2 months, 3 months, then you know that the body's kind of having more trouble with it. So it's either a big thing or a difficult to control thing. So that's when you start to try to find a diagnosis and maybe receive further, more complicated treatments.
Okay. And now, for someone who's watching, who's like, okay, back injection sounds scary. I know it's supposed to help with pain, but may call like, how do they prepare? Is there something they can do to prep for the visit with you?
So although every procedure, anytime a foreign body is placed through the skin, there is a little risk. Like even if you put in an IV or if you draw, right? Um, we've kind of perfected it where we use X-ray guidance, so
Okay.
it's very, very safe. The complication rates are less than 50%. So you know, definitely going online. I've got a lot of resources on my website, www.improvingpain.com. But there are a lot of resources online to kind of help educate you. And with knowledge comes power and confidence. So, and also knowing that the primary care doctor that you trust also trusts the doctor. Also, it's kind of that may provide a little confidence as well. But um, you know, some of the procedures that we do, even like things like epidurals, it's actually safer than labor epidurals because we are able to use X-ray guidance. So if you've had a child and you've gone through the labor process and you've had an epidural, it's even safer than that because it is essentially a very similar procedure, but with the additional extra guidance of using live X-ray to help guide the needle to the appropriate position, and then using contrast to confirm the appropriate location and the predictable spread of the medication before we actually give you the steroid or the numbing medicine to help achieve the pain relief.
Okay. I like how you emphasize the fact that there are steps to make sure to help ensure that this is conducive or tolerated or going to be low risk for the patient. So you made a good point with epidurals. Epidurals, we don't get like here's an X-ray to find out where we should put it first. It's just you based on anatomy. I'm not saying that's a bad thing, but I like that there's an extra step. So for someone who's watching who may need a back injection because um, it's starting to affect your quality of life. You're not able to move and do the things that you love. And it's starting to affect you mentally as well. Dr. Hong has highlighted some very important things that are done to ensure to help minimize the risk of any thing adverse happening. So the X-ray guidance, the contrast to confirm the actual location for where the medicine was spread. And then you mentioned that you have resources on your website. So I usually like to emphasize that it's good that you have a guided search on what you're looking to answer online and going to a trusted physician's website who explains how things are done is a good idea, not a blind search on the World Wide Web, because there can be a lot of scary misinformation out there as well. Now, my next question to you is for someone who's asking, like, well, okay, what have you seen the back injection help your clients do or your patients do? Because that someone is contemplating, like, I don't know, that I'm not sure is that much of a difference, but what could a back injection, based on what you've helped patients with, what could it help them do?
So there are a couple of different metrics we use to gauge relief after or gauge improvement after an injection. One, obviously being pain levels, right? So if your pain score is, a 9 or an 8 before, and then afterwards it's half of that, that's what we consider an improvement.
Hmm.
But what I really care about is, because pain can be fickle. It can, sometimes it can be worse when it's cold or wet or after activity. But what I really want to know is how are you functioning, right? If you can now physically walk, twice or three times as long as you could. Now, if you're now fully capable at work versus you were very guarded at work and you were not able to fulfill all of your job duties because your pain is so severe. You can't lift, you can't stand for too long or sit for too long. But now you're able to do that. Those are really good metrics and achievable points after an injection. And also reduction in medication intake. If you are, popping 6 to 8 ibuprofens a day, and then now you're able to get away with one or even none, that is another metric that we're trying to achieve.
Awesome. Also, different ways to measure success. I love that. And there's a big emphasis on quality of life, things they're able to do, as opposed to not. So that's great. Thank you. And my last question, or second to last question, is what questions would you say patients should ask their doctors before saying yes to a back injection? Are there generally any rules you have for that?
So definitely making sure that there is a definable pain generator. So let's say it's the lower back, right? The patient's coming in and they're saying, "Oh, my leg hurts." Well, then I would get an MRI to confirm that and be able to sort of find exactly where the problem is, so I can give the injection there to make the symptoms better or go away.
Mm,
There's a much higher likelihood of success if you are able to identify a pain generator, whether it's arthritis, whether it's disc related, whether it's nerve or spinal cord related. So I do typically like to have confirmatory imaging before I do perform an injection. And obviously, like, you have to be healthy enough, right? If your blood pressure is crazy out of control, if your blood sugars are also crazy out of control, it's just, it's safer to just wait for your medical conditions to become more optimized and better before we pursue an elective procedure. So I would say those are the main 2 points.
awesome, awesome. And so this has been very, very helpful. You make it sound very like it's doable. So this is an option, and of course, these are medical suggestions for those of you who are watching live or in replay. It's important that you make an appointment with your own doctor to come up with a customized plan for you. But pain or back injections can be an option for you to help improve your quality of life, to help you be able to do the things that are important to you. Now, on that note, Doc, some people are wondering, yes, we see your website. Thank you for the resources. But they would like to connect with you because they've been looking for a pain specialist in the area. Doc, where can people find you?
So I'm currently in Mansfield, Texas. So I'm a doctor up here. Um, uh, I'm located right next to Methodist Mansfield Hospital in Professional Building 1. The address you can find on my website, again, www.improvingpain.com. And yeah, you can reach out to your primary care doctor for referral to my office, or call us and let us know if you know, what steps need to be taken to be seen by us.
Awesome, awesome. Thank you so much for agreeing to do this on a Saturday morning. I appreciate you. Thank you, thank you, thank you, Doc.
Thank you for having me. Have a wonderful weekend.
Thank you. And for those of you who are watching, I put a link to connect with Dr. Hong, also his website and his Facebook page, so that we can connect with him as well. And on his website, you'll find where he's located as well and the number to call. And please, as always, share this video. Sharing is caring. Forward to those who could use this video to help improve their quality of life. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician in the Mansfield, Texas area, I am she. Happy Saturday, everyone. Happy Saturday, everyone. Thank you, Doc.
Thank you.
Bye.